Good afternoon, or perhaps even good morning to those from distant shores. Many thanks for logging on to this week's webinar during Back Care Awareness Week in the UK. I'm just going to pause for about 30 seconds to wait for one or two who may be struggling to log on, and then we'll press on. So if you just bear with us for just a moment. Okay. So once again, many thanks to everyone who has logged on to this week's webinar titled Beyond Back Care, Are We Missing the Trick? And I'd like to express a warm welcome to Tim Wright, who will be presenting the webinar today. Tim graduated from the University of Sydney as a physiotherapist in 1994 and pursued a career in elite level sports, including London Irish Rugby Football Club, Surrey County Cricket Club, England Cricket Under-19s, and the Sydney Olympics of 2000, culminating in the position of Head of Performance for Sussex County Cricket Club. Subsequently, he has held senior leadership positions for companies such as Nuffield Health, Spire Healthcare, 100 Years, and Optima Life, where he was a founder member and is commercial director. So naturally, he is passionate about optimizing performance in work, life, and health. So I'll now hand you over to Tim. So Tim, it's all yours.
Thank you very
Muted.
much. I appreciate the
Unmuted.
Thank you all for turning in such great numbers. It's
Muted.
over 100 people on the call. Thanks for that lovely introduction. A little bit about myself. Yeah, I'm a chartered physiotherapist coming from Sydney. In terms of my career, I've always been very interested in, firstly, elite sport. One thing that Rob missed out there was I trained to do functional measurements and functional capacity evaluations. So I've always been very interested in outcome measures and from a functional perspective and a physical perspective. But in that journey, I was with a colleague of mine from Lord's Cricket Ground, Simon Shepherd. We became very interested in the area of stress. Obviously, as everybody's aware, stress has overtaken MSK and lower back as one of the greatest reasons why people are off work, but it's very hard to separate the two. So I became very interested in understanding the measurement of stress, both from a psychological point of view and a physiological point of view. And that's really how my company Optima Life came about, where we started looking at both technology to measure physiological response to stress, as well as services that are built around it. We work primarily in the corporate wellness and performance market, but we also work within the NHS and some providers in private practice as well as starting to work directly with physiotherapists. And they're all interested in other areas of performance, especially what I'm going to talk about today, which is stress, recovery, and sleep. So I think that's enough of the introduction, and what I'm going to do is just, if you've got my slides, now I shouldn't be stuck on my slide, I'll just see if it works. Yeah, so the first slide that you should be able to see is I'm going to start with sleep. Is it something that we don't talk to our patients about enough? We don't measure? Do we get involved in giving people instructions on good sleep hygiene? So it's just something that I wanted to start with first. As you can see, a number of disasters that have happened around the world of human error. Could they be as a result of sleep issues, of fatigue issues? We feel that sleep we spend 1/3 of our life sleeping. We should put sleep on a higher pedestal. So we can look at airline staff, and that picture rightly points out fatigue is a big issue in the airline industry, and it's something that we're working with in terms of some research, looking at pilots, looking at changing time zones, and looking at sleep fatigue. So it's something I'll be talking about when I talk about the physiology. As you can see, some protests. I know in France there's quite a bit in terms of employee number of hours and fatigue that's going on at the moment. This is just where we're based. We're based at Lord's Cricket Ground, where we do a mixture of elite sport technology and human performance, measuring stress, sleep, and recovery. So that's our hub. just some of the teams we also work with, which is within cricket, rugby, athletics, and also with football. So we've taken some of the lessons of elite sport and we're taking it into the health and corporate environment. So these are some of our clients that we work with. We also do a lot of work within research as well. So I'm setting the scene between the link between sleep recovery and performance. Talk a little bit about health promoting physical activity. Some more facts and figures about how you can maximize your sleep and increase productivity. I just want to talk about some simple techniques for assessing your sleep and resilience, a few tips on travel, if that's relevant, and some general Q&A about sleep recovery and performance. I have got an interesting case study I want to talk about as well, which I'll run through at the end, which is a client that has a long-standing MSK problem, but is very much intertwined with the structure of the work, the poor sleep that the MSK is having, some things that she's doing in the evening before she sleeps, which we think is causing fatigue and is actually making her MSK conditions worse. Sorry, my screen is just frozen. I'll just sorry, I'm just going to, there we go. Sleep and stress. Who has been stressed? Who has had a bad night's sleep? We've all been stressed. Stress is important for us to live. We need stress. There's so much put on stress that it's a bad thing, but actually it can be a good thing as well. It's how we balance our resources. So something we look at is not just a snapshot over a day or even a week, but we measure people over a month or even perhaps a year. So we look at a longitudinal period of time to see if we can change behavior and measure those parameters. Definitions of stress. Stress is the body's reaction to a change that requires a physical, mental, or emotional adjustment or response. And it's all about the demand and supply of our body's resources. That's the way that we look at it. Oops. By failing to prepare, you are preparing to fail. That's a famous quote I just wanted to throw in there. By failing to prepare, you are preparing to fail. Poor sleep is linked with increased stress, and we know that. Increased risk of motor vehicle and industrial accidents, increase in BMI and obesity due to an increased appetite caused by sleep deprivation, increased risk of diabetes and heart problems, increased risk for psychological or psychiatric conditions including depression and substance abuse, and decreased ability to pay attention, react to signals or remember new information. How often are you in the zone when you're working? We're looking for that sweet spot for employees and for optimizing corporate performance, and we see these areas as some of the pillars of performance. It's now time for you to take a look. So where are you? And I put it out to you, where's your fuel tank at the moment? Is it full? Is it empty? Is it somewhere in between? And we really look at these pillars of performance and see if we can identify where the problems are and give tips and also give solutions for those individuals to improve those areas. So we look at the performance diagnostic, understanding you and what makes you perform. Is this what you do with your clients when you're looking at someone from an MSK point of view? So one area I want to look at is called recovery. It's out here on a Q&A perspective. I wake up feeling refreshed after a night's sleep. Is that true? What do we measure? Well, we want to look at the amount of sleep, but it's not just the amount of sleep, it's about the quality of sleep. What's the sleep environment about? And it's the timing of waking up as well. Are you a lark? Are you a morning person? Are you a night owl? And some of the actions I've just given, I'm just trying to give you a couple of simple actions that you might be able to give for your clients when you're looking at sleep. Organise your routine to permit more sleep. Minimise interruptions by preparing the bedroom and be tactical regarding sleep cycles. So have a strategy around sleep for your clients. Look at what they do the hour or two before they go to sleep. Can they perhaps have dimmers on their lights? Could they perhaps have no TV in the bedroom? Please make sure that they don't take their iPad or their laptops to bed. These things will influence or interrupt good sleep. This will, what I'll talk about is the parasympathetic and the sympathetic systems. This will increase the amount of sympathetic activity and make it harder to get a good night's quality sleep. This might be a question that's often asked. I often work on the computer, or I do work just before I go to bed. Considerations that increases stress and worry, no preparation for sleep. So the actions are find an activity routine that works for you, practice. I see a lot of clients where they're doing a lot of work late at night. They're eating late at night. They're exercising and doing a hard training session late. These are all things that are barriers to a good night's sleep. I consciously choose relaxation activities that help me unwind and calm before I go to bed. The alternatives, considerations, the alternatives, movies, Xbox, calls, emails, prep, bath, shower, exercise, sunlight and caffeine through the day. Not just focusing on the hour or two before bed, but looking out through the day. Are people looking at recovery or relaxation small periods throughout the day? A nap, yoga, meditation, mindfulness, all these things that will influence the balance of resources through the day and also promote good sleep. I regularly catch up on sleep at weekends, days off and holidays. Considerations, traditionally thought to be bad for you. Recent research has actually applauded it. We regularly coach it as a behaviour. So we do a lot of health coaching. And one of the things is if you've had a bad week in terms of work and stress, you need to catch up on the weekend. That doesn't mean on the Friday night going out for too many beers or alcohol, because that will definitely interrupt quality of sleep. It means about banking some recovery over the weekend, doing things that relaxing. So it's being strategic not only about the week, but on the weekends as well. Also about making sure that you build in some holidays that are relaxing, mini breaks, etc., that will increase the amount of recovery and those balance of resources. When I take holidays or short breaks, I crash and often get sick. This is usually a sign that not is all rosy, that your battery cell is almost at the limit, that your fuel tank is on empty, and it suggests a poor time resource management, and you should consider different modes of holiday or travel as well to more relaxing. Make sure you take your leave, make sure that you have your holidays, and make sure that you get the recovery. I use alcohol, recreational drugs, or cigarettes to help manage stress. Well, we know these things they do have physiological effects and psychological effects on the body, and they do interrupt with recovery. So think of other things in terms of exercise. I'm not here to put a big stick out and say you never drink, etc. We see sometimes that someone has a glass of wine, of top quality red wine even, a couple of hours before they go to bed, that actually does give them a good night's sleep. So it's about personalization strategies and what's right for the other. But it's certainly true that things such as smoking and alcohol, especially excessive, do stimulate the sympathetic nervous system and inhibit recovery. The other things that inhibit recovery are all these things outlined here: instant coffee, filter coffee, espresso, tea, cola, energy drinks. These are not the things that are going to help with good recovery, certainly in the evening or even throughout the day. I now have changed my behaviour to have only 1 or 2 coffees before 11 a.m. and no coffees in the afternoon, because I know what effect it has on my physiology. I consciously take regular energy breaks every 2 hours during the working day. I think this is a great thing. I know Posturite talk about mini breaks and from the desk in terms of an ergonomic perspective, but what about doing the same from a recovery perspective for your MSK, and also not psychological, but what about your physiology? Physiology be something that we seem to, as physios, skip. So I'm going to talk a little bit about physiology quickly, and how we use physiology and technology to manage stress, sleep, and recovery. So there is the 2 ways you measure stress is either through cortisol and also through what we call heart rate variability. Heart rate variability is what is on the ECG trace as the RR interval. Ooh, sorry, it's gone back to the start for some reason. I'll just flick through. Okay, it's to do with the autonomic nervous system. So this is looking at the role of the ANS to regulate and control the body organs to respond to the changing environments. So heart rate variability provides a non-invasive tool to study a cardiac function and the ANS function. Or more simply, what we measure is quite simply parasympathetic dominant system, which is your recovery, is your sleep, is your chill factor, and your sympathetic tone, which is either physically induced, which is activity, or non-physical induced, which is stress. So we are looking purely at a balancing act between the two. Heart rate variability will increase when you have a parasympathetic episode, or decrease when you have a sympathetic episode. This is two traces to distinguish the difference between heart rate and heart rate variability. So this is the same person on the trace and above and below that has the same heart rate, but their heart rate variability is very different. The difference is this person was overtrained over an 8-week period and is in fatigue, and you can see that significantly different heart rate variability, which if you put over a long period of time could cause health issues, or probably will if they're fatiguing at that degree. So this chart here looks at, is someone physiological coping or is someone physiologically stressed? The different colours are the different physiological states. The dark blue is physical activity. The maroon or crimson is stresses, so that's sympathetic dominant, non-physical, and the turquoise is what we call recovery or parasympathetic dominant systems. The height of the Manhattans or the charts is the height of the intensity. So you can see in the first chart, this is over a period of a day, the person does some exercise in the middle and then has, as most people do through the working day, levels of stress. And then in the evening goes to bed about midnight and has a really good night's sleep. That's called excellent recovery. The second one is showing the same trace over the same period of time. And what you do see, the person goes to bed at the same time, about midnight, but you can see there's hardly any recovery. The issues here were training late at night and drinking excess alcohol. And what you can see is that the facts that drinking alcohol and exercising late at night has reduced the amount of parasympathetic activity during a night's sleep. Now this is a one-off, this is one night, but if this was done time and time again, binge drinking for example, or someone not banking their recovery, this will lead to serious health issues. This is what we call the balance of resources chart. The top chart is a typical day and the typical chart of a good recovery. Person goes through the day and their stresses and they're losing what we call recovery, and then goes into their sleep and banks up and actually gets positive banking of recovery. The second one is just purely without any sleep and or any good sleep I should say, and not getting a balance of resources back into positive territory. And we worry about this, especially if we see this chart over a period of numbers of days, because that person will be fatigued. This is just to show some case studies about travel, for example. This is a long-haul flight to Australia, where I come from, and just showing that the person I was travelling with, who was wearing one of our monitors, actually felt that they were sleeping, but actually got no physiological recovery during the 24-hour flight. So jet lag and long-haul travel, or even short-haul travel, can have an effect on recovery. This is the first night. The top graph is the first night after arriving in Sydney, which shows the sleep period, no recovery, and recovery only happened after the second night arriving in Sydney. So what we do with executives is strategically planning and personalising their business trips so that they're optimising their performance when they have their business meetings. We've got the same in shift workers, and you can see over a 3-night shift that recovery tends to drop, and there's a lot of research on this, especially for night workers. So in summary, and I know we want to take some questions, is in summary, life is a balancing act, and what I feel, or certainly we look at, is balancing the load between stress, recovery, or stress and coping, and giving people bite-sized chunks and health coaching towards improving either recovery at night or throughout the day. Sleep is a golden chain that ties health. Missing trick. We really don't spend enough time giving people advice or strategically managing our own sleep to perform through the day or even for a week. We know movement and exercise is vital for the body, but it also has a very crucial effect on recovery. That being said, it's about the intensity, the frequency and duration, but overall it has a positive effect on the parasympathetic system. It does have a negative effect sometimes on time, intensity, and duration. So you need to strategically plan exercise as well. Okay, so that's in terms of my presentation. I just wanted to show you a quick case study of a client that, sorry, I don't know what that is, that has allowed me to show this report for you, which looks at stress and recovery over a 3-day period. This person has had 18 months of significant back problems and is a high-flying executive, female executive who is also self-employed, so does need to do a lot of her work in the evening. And as you can see from the first graph, as I've moved my cursor, hopefully you can see it, is that in the evening she is getting a lot of sympathetic activity. And that is really because she's doing a lot of housework. She's watching TV, and she's also doing, after she does her housework, a lot of work on her computer. So it's stimulating her sympathetic system. So what we're actually seeing is when she goes to bed at midnight, that she's not getting recovery until right through till 5:30 in the morning. So that's a real issue for her, and that's manifesting her back pain. Now, if we look at the second night, it's almost identical, that again, she's having poor sleep. She's able to find some recovery during the day. And what is interesting to note with the green patch around 5 is, sorry, in these reports, the green is the recovery as opposed to the turquoise blue previously. So what we're finding here is that she's talking to her partner about just catching up over dinner. And this is reinforcing to her that actually taking a time away from her work and spending time with her boyfriend and having a nice meal actually produces recovery, not just in the night, but during the day. So that's a positive reinforcement that she should do that more often. Obviously, we see sometimes the opposite, but this means that obviously there's a good relationship. And then on the third night, she gets better recovery. And that is because she's being able to plan her day better. She's not doing as much work late at night, and also she's not drinking any alcohol, which she did on the previous nights. So I just wanted to show you that the balance of resources is for her an issue. The way she organises her life is an issue in terms of her recovery and also her behaviour. So I'm working with a top physiotherapist with her, and these are our measurements before physiotherapy and MSK. And what we're doing is after a 6-week period of intensive rehab, we're going to re-measure her. We've also got some goals for her to do for sleep hygiene, for changing her behaviour, and for structuring her life better. And we're going to see both from outcome measures from physio, rehab, but also from this area in terms of stress, recovery, and sleep. We also look at things like health promoting physical activity, what you're doing the day and are you getting health benefits, and obviously training effect as well. So Rob, I'm going to throw it back to you.
Unmuted.
I just wanted to, there's only about 8 minutes left, but I just wanted to see if we've captured, I think we have, in terms of what I think is a missing trick. I think passionately that physios need to look outside the scope of just purely MSK in terms of just, I should say, manual treatments and exercise, and we should start moving into the areas of looking at these other areas, sleep, stress, and recovery, and have as healthcare coaches, we should be able to give advice to our clients.
Yeah. Tim, I think you covered it admirably. So thank you so much, Tim, for that, and thank you everybody for logging on. So if you'd like to make sure you log on again to our next webinar titled "When the Inspector Calls," and this webinar is given by Sarah Tapley on Friday the 17th of October. So make a note in your diary for that. Sounds very intriguing. Thanks again, Tim, and thanks everybody, and hope you all have a great weekend.